Anatomy of sciatica coming up next. Hey there, Cat Matlock here at FreeBody, and I pulled this video out of the archives. It's from an old course, an old online course that I made a few years ago for folks suffering with sciatica pain. I made this course with so much love and way too much information, too many things, because I care so much about folks suffering from low back and sciatica pain, because I suffered with it for many years and I was frustrated and I didn't have the help I needed. PT didn't work, all the things didn't work, right? And so maybe you're in that and in that kind of cycle. And so that's the reason I do all of these sciatica support videos. But also this one, I thought, it's really helpful for people to understand the anatomy of sciatica. Like, why do I have sciatica in the first place? Why is this happening? And so in this intro to the anatomy of sciatica video, I kind of break it down like, here's what can happen. Here's true sciatica versus false sciatica. Here's muscular causes of sciatica symptoms. So you're going to get some really key information. Once you understand, then you can effectively fix. If you don't understand what's going on in your body, it's going to be very challenging for you to actually do the things that will fix you and get you out of pain. So, anatomy for sciatica, I hope you enjoy it.
Hi, and welcome to our anatomy discussion of sciatica pain. I understand sciatica pain personally because I had debilitating sciatica off and on for about 16 years. And now I never ever have that pain again, not ever. And I want that to be your story too. And what I believe is key for you shifting out of this pain loop is understanding where the pain actually might be coming from, or the dysfunctional tension that might be existing in your tissues, where that tension lives, and then how to get rid of it. So we're going to work through this anatomy portion so that you can understand and really be empowered with that understanding of how things work. And it's helpful to understand what trigger points are, because often the pain that we're experiencing in our bodies isn't coming from where we think it is or where we feel it. That deep nagging ache in your buttocks may not actually be coming from that area at all. Actually, most of the time it is not, which is why you rub on it or you get a ball in there and you push on it, and it doesn't help ever, because it's not actually coming from there. And a lot of the pain in our bodies, including nerve pain, comes from trigger points. And trigger points are focal points of tension in our muscles. We'll talk more about that in a moment. But trigger points cause tensional imbalances within muscles that do the same thing and muscles that do the opposite thing. And if you want to get rid of your pain, you really have to address all the muscles in that group. So I'm going to introduce you to the muscles that cause sciatica pain. And we're going to talk about trigger points within the muscles themselves. So what is a trigger point? Trigger points are, as I said, focal points of tension in our muscles. They are how our muscles hold tension. So if you have tension in your muscles, you have trigger points. They are the same. And trigger points are those tender knots that you get in your tissues, and if you rub on them or press on them, they feel sore. Trigger points are tender to the touch, and they can cause you to feel pain elsewhere. So sometimes you feel it where the point is, and sometimes you can feel it really far away. There's a point in one of your calf muscles that can cause aching in your jaw. Sometimes it makes sense where the pain refers to, and sometimes it doesn't. But it's my specialty understanding what those pain referral patterns are and where the pain is actually coming from. Because part of the tricky thing about trigger points is that they can mimic nerve pain. And I've worked with people with trigeminal neuralgia, occipital neuralgia, thoracic outlet syndrome, and sciatica, and whether or not it's true or false sciatica, this work is really going to help you to get rid of that pain. So again, my specialty is knowing where these points live and what kinds of pain they cause in the body. And reminder, it can be pain, it can be nerve pain, it can be nerve sensation, it can be numbness, tingling, it can be like itchy feeling. All of those things, besides just pain, can be caused by trigger points. So a quick review of sciatica pain symptoms, because you may have some or all of these, but probably you just have some of them. So we're going to talk about where all of these symptoms come from: pain in the buttocks, pain in the hip, pain that radiates downward the back of the leg, pain that radiates downward along the side of the thigh and the leg, sharp, sudden, debilitating pain, inability to stand on one leg or your leg gives out. And that was a big piece of my sciatica. I had to sit on the bed to pull my pants up on one side because I couldn't stand on that leg. My hip would just give out and the pain was so bad. So weakness in the hip of the leg, hard to get up to standing, difficulty standing, walking, running, hiking, biking, dancing, you name it. Anything fun is hard to do when you have sciatica, and pain that wakes you up at night and you can't sleep. So let's talk about this. Is it true sciatica or false sciatica? In my experience, about 90% of the people who come to see me actually have what's called false sciatica. This means that their muscles are causing their sciatica pain. And even if you have true sciatica, this information can change your life because the things you do to alleviate that pain are basically the same. It's the same muscle groups that you'll need to be working with. And whether or not the pain is fully coming from the nerve, compression on the nerve, or muscles ultimately doesn't matter because these practices will fix both. So true versus false sciatica. True sciatica is a condition that occurs when a herniated lumbar disc compresses one of the contributing roots of the sciatic nerve. That's from myspinedoc.com. False sciatica is everything else that appears to be sciatica, but there is not a herniated or a bulging disc. Even if you have a herniated or a bulging disc, some or even much of your pain may not be coming from that. As a matter of fact, there are zillions of people walking around right now with herniated discs that do not even know they have a herniated disc, because a herniated disc does not necessarily mean that you're going to be in pain. The sciatic nerve is the longest nerve in the body, and notice its path on the back of the thigh and the leg. So in this picture, what we're seeing is the back of the right leg, right side buttocks, right heel is at the bottom. And so we're looking at the back of the right leg, and we see that this long sciatic nerve and its whole path. So true sciatica follows the path of the nerve only. So it can ache in your buttocks, it can ache down the back of the center of the thigh, and then ache down the center of the back of the calf. And there are still trigger points that can cause that same pain. So true sciatica is a compression of the sciatic nerve somewhere, usually in lumbar spine, usually L5-S1 area or L4-L5-S area, where actually the disc is pressing on the nerve itself. If you have pain anywhere else, such as along the outside of the thigh, weakness in the hip, your muscles and your trigger points are causing that pain. Gluteus minimus is called the sciatica imitator and is often the cause of sciatica types of pain. So let's look at that pain referral for a moment. Gluteus minimus trigger points and pain referral patterns, what you're looking at is a picture of the X's mark where the trigger points live in the tissue. And what's so cool and helpful about trigger points is that if someone has the pain referral pattern like the one on the right picture, where it's going down the side of the leg and down into the calf, into the foot, they will have those trigger points on the side of the hip, from person to person to person. So we have maps that we can follow and following this pain. So note that the deep ache in the buttocks, pain in the hip, pain radiating down the back of the thigh into the calf, pain radiating down the side of the thigh down to the ankle and the foot. All of these pain patterns can come from trigger points in your little gluteus minimus muscle. Does any of that look familiar or sound familiar to you? Yeah, sounds just like sciatica. As a matter of fact, it sounds exactly like sciatica. And it may not be true sciatica after all in your body. So to really fix the pain coming from the gluteus minimus, we need to relieve its trigger points and tension. To effectively do that, we need to address gluteus minimus, gluteus medius, the inner thighs, and the quadratus lumborum muscle in the low back. Notice I didn't say piriformis. I did give you a section in this course on working in the piriformis, but often, we'll talk about piriformis in a little bit. So first, let's meet these muscles and learn how they get out of whack, and then we can talk about how to get things better. So we'll take a little break, and then when we come back in the next discussion, I'm going to introduce you to these muscles, and we're going to talk also about piriformis. Welcome back. Let's meet these muscles. The first and most essential muscle group in healing your sciatica pain to address is the inner thigh abductors. These muscles live on the inside of your thighs, and they draw the legs towards each other. This muscle group is often the key to unlocking sciatica pain so that it can be tossed to the side. If you are not having your inner thighs worked on or not working on themselves and they're not being addressed, then you will not ultimately be able to get yourself out of pain or to feel better. These muscles get full of tension when you cross your legs, when there's sexual trauma, when you're standing with your weight on one side over and over again in your posture, if you have one hip higher than the other, if there's a leg length inequality, any activities such as dancing, cycling, horse riding, skiing, and other activities where you draw your legs towards each other. Notice the beginning says they get full of tension from crossing your legs. So if you sit with your legs crossed all the time, you are going to be reinforcing your pattern of sciatica. And I go more into that in the active posture module, which you'll see soon. So here's the inner thigh muscles. They live from the pelvis down along the inside shaft of the femur, all the way down to and cross the inner knee. Someone crosses the inner knee and they draw the legs towards each other. Now, their counterpart, the muscles that do the opposite of that, are the gluteus minimus and medius. And remember, our gluteus minimus is our sciatica imitator muscle. These two muscles, gluteus minimus and medius, draw the legs away from each other. They're called the rotator, I call them the rotator cuff of the hip, because their job is not only to lift the legs away from each other, but also to stabilize the femur in the socket. They get full of tension mostly from being pulled by the inner thighs. And I would add from misaligned posture, from standing with your weight on one side or carrying a baby on your hip or carrying heavy items more on one side than the other. So gluteus minimus and medius are the rotator cuff of the hip, and the outer glutes, the abductors that lift the legs away from each other. Now, these muscles work very hard to stabilize your femur with every step you take and every time that you are standing. So if you're harboring tension in the inner thighs, they're constantly going to be pulling on those gluteus muscles, and it makes them work hard all the time, even when you're sleeping. So if there's a lot of tension in the inner thighs, they're constantly pulling on these outer hip glute muscles and making them work overtime, and they become exhausted. So sometimes your pain will increase when you walk because gluteus minimus and medius are contracting really hard to stabilize your femur in the socket. And cycling, dancing, skiing, horse riding, those are all activities that increase tension in those inner thighs and then will further exacerbate your pain because they're increasing the pull on the gluteus minimus and medius. And the gluteus minimus and medius are hanging on for dear life. And then, because they're constantly being pulled by those inner thighs, then you go for a walk or a run or go dancing, and you're asking them to work really hard to move your legs or your hips side to side, or to just stabilize that femur in the socket. And they're already exhausted because they're being pulled on all the time. So this is how that relationship between the inner thighs and the outer hips comes into play with sciatica pain. Because if you're not releasing your inner thighs, your gluteus medius and gluteus minimus cannot release, cannot get better. So the last muscle that we're going to talk about, actually we are going to talk about piriformis, but here we want to talk about the quadratus lumborum in the low back because it also can create sciatica type symptoms, and it's part of this hip height, leg length inequality sciatica situation. So quadratus lumborum lifts your hip up toward your shoulder, and it also draws you into a side bend. It also stabilizes your lumbar spine when you move or walk or when you're standing for long periods of time. Its job is to stabilize the low back spine. So this is why often people who get into a car accident will immediately have neck issues because that takes the brunt of the accident, but then eventually we'll have lumbar spine issues and low back pain, which then can become sciatica because of the tension in the quadratus lumborum. So this muscle also gets full of tension when you cross your legs, standing with your weight on the one leg, hold a child up on your hip, hold heavy things more on one side, have a leg length inequality, anything that puts one hip higher than the other. Tension here in this muscle is the cause of slipped and herniated discs. So let's talk about that for a moment. So in this picture, the left hip is higher than the right. The quadratus lumborum will be short on that left side. This lateral tilt of the pelvis forces the discs in the lumbar area to bulge out to the right. The disc can then press on the sciatic nerve root, and bulging discs can eventually herniate. So we're looking in this picture at the back of the body. We see the sacrum, that bone in the middle, the two sides of the pelvis, the iliums coming up on either side. The left hip is sitting higher. The left QL is going to be short. But what we also might experience is that when that QL is lifting, the glutes are just below it trying to pull the hip down the opposite way and stabilize the femur in the socket. So the left glutes are going to be pulled long and out of whack, but the left inner thighs are going to be short because they attach into the pelvis and contribute to that tilt to the side. You don't have to remember all of that, but it's important to see how these three muscle groups are all players in a lateral tilt of the pelvis, leg length inequality, maybe a little scoliosis, and specifically, very much so with sciatica. So notice that all of these groups, these muscles get out of whack when you cross your legs. So to heal, don't cross your legs. And it's better to sit with your feet at least hip distance apart so you're not reinforcing it. Again, we'll go into that a little bit more in the active posture section. So what about piriformis anyway? Piriformis often gets blamed for sciatica symptoms. My piriformis was blamed for my sciatica. And because I kept trying to work in my piriformis for a decade, it never worked. It didn't help because my pain and my problems actually were not coming from my piriformis muscle at all. So sometimes tension in the piriformis can press on the sciatic nerve. You can see here the yellowed in piriformis muscle, sciatic nerve running deep to, like behind the piriformis muscle. So tension can press into the sciatic nerve. But if you're treating piriformis and your symptoms are not improving, it's probably not coming from there. And often my experience, as a matter of fact, it's not. It's often not piriformis. Piriformis is a piece of the puzzle, but often the symptoms that we are experiencing are relevant more to the other muscles in this tensional system than just piriformis itself. I want to introduce you to the edges of your belly, because this is a key piece of your pain-free protocol that you won't want to skip, even though you might look at it and think, I want to skip that part, because I am going to ask you to work with a ball in your belly, but a very soft, very forgiving ball. Because you see, what you see on the edges of the belly are these thick lines of connective tissue on either side. There's that rectus abdominis in the middle, and you can see on the two edges on either side thick lines of connective tissue. Now, connective tissue, its nature is to be sticky, is to bind. And over time, if you've ever leaned forward or slouched or texted or read in bed or driven or all the things that we do in life, we tend to round forward into those things. When we do that, those edges of the rectus abdominis can stick and pull our rib cage down toward the pelvis. And that can contribute to quadratus lumborum getting out of whack. It can contribute to why it can become hard sometimes to stand up straight without pain. And it creates a constant pull on the back muscles. So we need to release those edges of the belly a little bit with a ball, so that the QL and the other muscles can kind of soften back into place. If one hip is sitting higher than the other, that side, that line of that connective tissue is going to be shorter. And if you don't address that line of connective tissue on that higher hip side, you're going to have a really hard time shifting yourself out of your sciatica pain. So this is a key piece that is often missing in most sciatica treatment protocols. So we're going to release the edges of the belly. We're going to work in our inner thighs, work in the glutes, work in the quadratus lumborum, and finally get out of that sciatica pain. So in the next section, I'm going to go through the pain referral patterns of these muscles so that you can really connect the areas specifically where you're going to want to focus a little bit more attention so that you can find relief. So I'll see you in the next one. Hi, welcome back. So now that we've met the players, let's look at their pain referral patterns and what tension in these muscles feels like. And you may have some combination of any of these symptoms. So let's get started with those inner thigh muscles, because often the inner thigh muscles are really the starting place of sciatica. So the inner thighs can cause pain at the groin, aching deep inside the pelvis, pain in the inner thigh and the inner knee. And you may have tension here and not have any of these symptoms except your sciatica, because often these muscles are short and they create that constant pull on the outer hip glutes, which makes them cry out in pain and make your sciatica symptoms happen. So here's the key in understanding about trigger points and tension in our muscles. Often the muscles that are short are not the ones that we're having our pain in. Often the muscles that are pulled too long and that are working against the pull of another muscle group, they're the ones that are crying out in pain. So the inner thigh muscles, because most people cross their legs or often hang out with their weight on one side more than the other, those inner thighs tend to get short. And it's actually the muscles that are opposite the joint, the hip joint, the outer hips, that cry out in pain. So to truly be free of sciatica pain, you must address the inner thighs and release their tension. And now we're going to look back at gluteus minimus, and we're going to layer in gluteus minimus's best friend, which is gluteus medius. Again, these two muscles together stabilize the femur in the socket, and it can be why walking or movement aggravates your symptoms and makes your symptoms worse. It may have nothing to do with the sciatic nerve itself. So if we look back at gluteus minimus, we see that deep ache in the buttocks, ache down the hamstrings, down into the calves, ache down the outer thigh. Their symptoms can feel like hip weakness, that hip giving out. It can feel like SI joint pain and dysfunction. You can see gluteus medius now. We're meeting gluteus medius. The picture on the right, it holds a trigger point right next to the SI joint, and then its trigger points line up along that top rim of the pelvis. So if you get into that SI joint and work along the top rim of the pelvis, you can alleviate the symptoms and pain associated with gluteus medius. So you might have these symptoms layered. You might have gluteus minimus trigger points and gluteus medius trigger points layered on top of each other. And so it could feel like deep ache in the buttock referring downward, as well as deep ache in the buttock referring up along the SI joint and into the low back and even onto the sacrum itself. So layering those two together, we can start getting a bigger picture of sciatica symptoms associated with these muscles. Remember, gluteus minimus is the sciatica imitator. Now, quadratus lumborum, that muscle that lifts the hip up, is definitely a player in herniated discs and bulging discs. Quadratus lumborum has a particular electric-like quality to it. I've had clients say, I feel like I'm being stung by a bee in my SI joint or down in that area. Or they'll say, I got up to go to the bathroom in the middle of the night and I had hit the floor. I couldn't even walk across the floor. So you can't walk across the floor because you get that searing electric pain, and crawling on hands and knees is going to make it better because you're not upright holding your body weight on the quadratus lumborum, which is trying to stabilize your lumbar spine with every step and movement that you make. So getting down on hands and knees alleviates that pressure. So if you're getting down on hands and knees to crawl to the bathroom, or you get up in the night and you hit the floor because the pain is so stabbing and so sharp, it could be that is coming from your quadratus lumborum. Yes, it could be compressing into the sciatic nerve. Yes, it could be that the quadratus lumborum itself is aggravating things. You are going to want to release this muscle and work with strengthening and balancing the two sides of quadratus lumborum to fix your sciatica pain. Yes, this muscle will wake you up at night, and this is the muscle that brings you to your knees when it has a lot of tension that's really fired up. Quadratus lumborum. So those are our three biggest muscle group players. We have the inner thighs, and we have the outer hips, and we have the low back, the quadratus lumborum in the low back. And because most therapists, doctors, chiropractors never address the inner thighs, you'll often get stuck spinning your wheels trying to get better, but you can't, right? You might get a little better, but plateau. Or maybe it goes away for a little bit and then it comes back. And I want to help you get rid of that pain for good, like I did, and as many of my clients and students have done. And I want you to bring this new anatomical understanding of where that pain is coming from and the tensional systems that may have led to you getting into this situation. So now you can be empowered to truly fix those tensional imbalances. So to do that, to release tension and trigger points and muscles, I teach people how to use balls and foam rollers and other tools. So having simple skills in the use of therapeutic rolling, coupled with easy movement breaks throughout your day and some deep belly breathing, is what is truly going to get you out of pain. I have had people limp into my classes and walk out without pain. And it doesn't mean that the pain doesn't want to come back. And that's why you do a little bit every day. And then over time, the pain often never comes back. Or if you start feeling those early signs like, oh, I got a little twinge here, you just do a little bit of your practices, and then it most often doesn't turn into a big flare up of your symptoms. I have seen it time and time and time again with my students and my clients in my clinic and my students around the country.
Hey, before you go, click on the link below, ineedsciaticarelief.com, and you'll get a free download of how to get yourself immediate relief from sciatica pain. Get immediate relief from sciatica pain. Click on the link below and grab yours today.